Hello and welcome to the Bubb Report. Last week, the COVID-19 pandemic continued its crippling and debilitating impact on Grenada. The Reuters COVID tracker predicts that Grenada is still nowhere close to flattening the curve, with the death toll and infection rate being at 88% of its peak. However, data scientists from Our World in Data paints a different picture of the curve, suggesting a slight dip from last week's 7-day rolling average, but still the highest confirmed cases among all of Grenada's OECS counterparts. Gaston Brown, Antigua's Prime Minister, sounded the alarm with respect to Grenada's COVID crisis and what it may say for the rest of the OECS region.
There is literally a growing crisis within the OECS. Let us look at St. Lucia. St. Lucia has about 180 deaths so far, thousands of active cases. Grenada, which prior to 3 weeks ago, colleagues, had 2 deaths. They have 85 deaths now. Just gallop past Antigua and Barbuda in a matter of what? 3 weeks? 85 deaths. In fact, the rate of deaths are literally overwhelming the system in Grenada. They're now storing bodies in refrigerated containers.
The highest daily average of infections was reported on September 21st. Also on September 21st, the country reported 13 deaths, one of the highest totals in this first wave. Behind these numbers are harrowing tales of loss, death, and sadness. The neighboring island parish of Carriacou and Petite Martinique was hit particularly hard last week, as the virus was responsible in part for the deaths of two of its famous and notable residents, Leonora Massima Noel and Eileen Fortune, both nursing home residents. Eileen Fortune was a cultural icon for her decades-long contribution to the tradition of the African big drum dancing on the island, and Leonora Massima Noel was Grenada's oldest citizen who lived to the golden age of 119.
Well, when they're going, say, so you're going, say, yeah. I say, well, when I will see you again, you say, I will see you, you go see me, you know when you go see me next birthday. I say, well, all right, you go in. When you go see me, I have 117, so you go come and when you come, you go see me, I go have 180, 18.
This week on the report, we go beyond the data to make sense of these numbers and what it means for the current epidemiological picture for the country, as frontline workers continue to risk their own lives while caring for COVID patients at the country's main hospitals. Also on the Bubb Report, we talk COVID survival with both vaccinated and unvaccinated former COVID patients from Grenada and its expatriate community, so that the national community can make sense of this national crisis. We welcome our guests, Sustainability Advisor Jennifer Alexis, Extension Officer Brenda Phillip, artist and former educator Igel Joseph, and epidemiologist Jared Sincere. Our host for this week's episode of the Bubb Report is Kitaka Mawuto. We thank you for joining us.
Welcome to the Bubb Report. Today, Sunday, 26th September 2021. I want to say thank you to everyone who is tuned into the program right now. We appreciate you. First off, my name is Kitaka Mawutu, filling in for Dr. Kellen Bob today. I would like everyone who is on the show right now to go into the comment section and to wish Dr. Bob a happy birthday. Today is his birthday, and the team here at the Bubb Report sends out the best wishes to him and hope his life continues to flow with good health and prosperity and all the good things that life has to offer. Today, over the recent weeks, the energy over Grenada and Carriacou and Petite Martinique has been very heavy. It's basically been impossible to have conversations with anyone and not mention COVID-19, lockdown, vaccinations, stress, worry, fear, and a great sense of uncertainty about the future. I know many of us are going through some sort of trial right now in many different and unique ways. For some, it may be unemployment, COVID-19 infections, hunger, mental and emotional stress, you name it. At this point, I would like to take this opportunity to send love, blessings, and energy of hope to everyone in Grenada, Carriacou, and Petite Martinique right now. I pray that you will be supplied with the energy and inspiration to rise out of the situation that you face currently. And I pray that great health, abundance, and prosperity comes your way in full speed. And I call on every Grenadian citizen to summon the Grenadian spirit of unity, support, care, compassion, love, and be there for each other in any way that we can in this, trying moment. My condolences goes out to every Grenadian family who has lost a life, some member of the family as a result of COVID-19 in the recent weeks. And let us all continue to do what we can to keep ourselves safe and the people we interact with. With that said, I welcome everyone to the show, and we wish Kel and Bob a happy birthday and a wonderful day today. Now, today on the show, we have two different segments. At the start, we will jump into dissecting the COVID-19 situation and the data and the numbers with our epidemiologist, Gerard Sinclair. And part two, we would talk to some COVID-19 survivors and really kind of get an in-depth understanding of that entire process and the stories and the experiences that they have had in terms of overcoming the virus. So I welcome you guys now to share the program, leave a comment, ask questions, whatever you can in the chat box. Welcome to the program, Dr. Gerard Sinclair, epidemiologist. We appreciate having you on the program. You have been here before and have been, always willing and coming forward to share information and to educate Grenadians about the whole COVID-19 situation. So we really appreciate having you on the program today. Thank you for joining us.
Thank you, Kitaka, and allow me to wish Dr. Bob a happy birthday. I hope that God will continue to bless him and to lead him along the path, the journey which he has to travel, impacting lives and imparting knowledge. Having said that, I'm happy to be on the program again, and I want to thank you for having me and hosting the program today. I'm sure it's going to be one that is educational as we discuss the COVID-19 situation in Grenada.
Okay, thank you, sir. First off, talk to us about the COVID-19 infections data. We are seeing in Grenada right now. Are we anywhere close to getting on the other side of the curve?
I would say we are approaching the flattening of the curve, but we shouldn't be too lax in our adherence to protocols, because easily, whilst we may be approaching based on the fact that we've become a little bit more sensitive to adhering to the protocols and the curfew during the week, together with the lockdown on weekends, may have contributed to the slowing down over the last few days. But that doesn't mean that it cannot pick up again. So we have to be very careful in not getting too relaxed when we see a decrease in number of cases identified, because there may be a number of reasons that could have contributed to that. We may have tested in an area where the infection rates are low, or we may have tested less individuals. So all these are factors that could contribute to decreased numbers. But based on what I'm seeing over the last 4 weeks in terms of the trends, I believe that we are approaching it with continued high adherence to the protocols. And we are aware that we have a large percentage of the population that is still unvaccinated. And so we have to be careful not to become too relaxed in our approach towards controlling the spread.
The numbers as it stands, what else does it tell us? Any more insight into the numbers as it stands?
Yes, Kitaka. I just want to draw attention to the number of deaths that we've seen skyrocketing over the last 4 weeks. At present, we have a total of 116 deaths. And let me just explain simply what that means. Now, based on experience in the larger world, the developed world, what we've seen globally, for every 1,000 cases of COVID-19 infection, we expect to realize a total of 15 deaths. So what I did was a bit of math, right? I took the 116 deaths and I divided it by 15 to find out how many groups of 15, which would be equivalent to how many thousands of individuals actually on average may have been infected. So when I did that, that is 116 divided by 15 multiplied by 1,000. I'm getting a total of just about 7,733 cases. So that gives me an idea of how many, the total number of cases that we may have had in Grenada. Now, we have only identified a total of 4,829 cases. And that could be many reasons. Some individuals not being tested, limitations with resources and personnel to test a broader cross-section of the island. So the difference is we may have missed 3,000 cases that were individuals that were infected with COVID-19. Now, potentially that has some serious implications because those 3,000 cases could have infected a maximum of 17,500 individuals and a minimum of just about 9,000 individuals. So there are a number of individuals who are out there who may have recovered already, who have had it, who may have spread it, and we have not been able to capture it. So the number of cases that we are seeing, 116, indicates to me that there are many more cases outside there that we have not identified.
Okay. So what do you make of the current testing systems that is currently being executed by the ministry, and is it hitting the mark, and how critical is testing in this whole COVID-19 process and getting us to a better situation?
It's important that we get an accurate picture of what's happening in the population, and I believe that the Ministry of Health, with the limitations, are doing their best, and they're really stretched now. I heard the minister calling for private doctors to come on board to assist with a number of different activities as it relates to that. When it comes to the science of testing, there are many factors that could contribute to a test, and we should not believe that a test is 100% accurate. There is sensitivity of those tests that we do, and I think it's up to about between 60 and 80%. So we may miss just about 1 in every 3 cases at times. And so we have to be mindful that there are limitations with tests, but we are using what's available to identify individuals who may have been infected. Now, the responsibility is on us as citizens of Grenada to get ourselves tested, to get an idea of what our status is, and in so doing, if we are positive, make the necessary adjustments by adhering to the protocols. And that, as I've stressed over and over, would support the activities that is being done to control the spread of COVID-19. Now, largely, the rate at which this spreads is largely dependent on our behaviors, and I've been saying that over and again. If we do not take this seriously, the curve would continue. It would continue to increase because the Delta variant is highly infectious. One infectious person can infect up to 6 susceptible individuals, and that's very high. And so we have to be concerned that our behaviors, we have to be aware that our behaviors largely would depend on how quickly we get to the other side of the curve. And each Grenadian needs to take that responsibility seriously.
Okay, as it stands now, we at the Bubb Report don't have specific demographic data about the age range of the deceased. However, the anecdotal data from numbers suggests that Grenada's senior population has been hit hard in this first wave of COVID-19 infections. What's your thoughts on this occurrence?
That is supported by what we know. We know that the elderly, they are a high-risk group for severe illness and death, and largely because one, age is a risk factor for illnesses and other underlying illnesses, etc. And so it complicates matters when you get infected by the SARS-CoV-2 virus, and with underlying conditions, with compromised immune system, that complicates matters. And usually what we've seen is that the case fatality rate among the elderly is very high, and we have to protect the elderly. It is our responsibility. Most of them are shut in. Some of them go out very, very scarcely. They don't visit out. They don't go to the supermarkets or to the stores or travel much. And largely, most of those individuals who were infected I'm sure, were infected as a result of someone coming to them and infected them. And that is very sad because the elderly people are libraries. They have so much wisdom and knowledge of the things that we do and why we do our culture or practices. And if we continue to lose them, we are losing libraries. Each time an elderly person dies, we lose a library. And that is sad because we must understand that it is our responsibility to protect them. We have to protect them. We are the ones that are infecting them because they largely stay inside. They don't meet much individuals on a daily basis. And so again, Kitaka, it's our responsibility. I feel very sad talking about this because I know the value of the elderly people to any nation. And if we continue to lose them, there would be a serious gap that we will not be able to bridge in the future.
Yeah, well, that has touched me as well because I owe a lot to many of the seniors that I've interacted over the course of my life in terms of helping to, instill certain morals and values and just, different experienced ways of doing things, to really help you along life journey. So, definitely we need to take that responsibility to be there for them and to take all the necessary precaution. But moving along, in spite of the 3 no movement weekends, the numbers are creeping up. In your capacity as an epidemiologist, what could potentially be contributing to this?
One, we have to understand the culture, of Grenada. We have to understand the close knit community structures that we have, the homes that we have, and so because of that, it really is the ideal situation for the virus, a highly infectious virus like this one, to spread. Typically, you'd find many individuals living in a home, and so the individual space is limited. That's ideal. And so if one person gets infected, it's really a challenge in most homes in the communities to isolate that individual. And typically you'd find that, the family may get infected as well. Again, a lack of understanding of how we should handle the cases within homes, how the individuals who are infected should behave as well, the do's and the don'ts. All those things contribute to it. There are other individuals who test positive and are in total denial of the test result, who would continue to behave as normal, and that would contribute to the spread of the virus. There are other individuals who totally disregard the protocols that we have established that is effective in controlling the spread. So all these things contribute to it. There are other individuals who believe that the COVID-19 virus is a total hoax. So, these factors that continue to be present within our communities. And Kitaka, I read, this morning, something that just made me smile. It said, that myth is something that circulates very quickly when there is a lack of trust and knowledge and information that educates individuals. And so what we are seeing here with the many conspiracy theories and the myths, the beliefs, etc. It's a total mix, and there are many reasons that contribute to it. And I hope that more and more Grenadians would take the responsibility to learn, to educate themselves about it. The information is there in the palm of our hands on the smartphones. We can access information from a variety of sources so that we get an objective view of what's happening. When individuals can say COVID-19 is a hoax, and we see globally the impact that it has had. We see right in our own country the impact that it has had. We're a small population, 105,000, I think. Out of the 116 individuals who have passed, I am sure that each Grenadian would have known one of them. So there is someone that we have known that would have died already, and it continues to rise, and the impact continues to be significant through the loss that we've had. the effect that it has on individuals' health, the stress that they have to go through being quarantined and waiting to be retested to be cleared because the authorities are so stretched they cannot keep up with the schedules as established, and so that is just complicating matters. And I believe more and more as we continue to see how it's affecting us, we need to respond positively to control the spread. We need to respond positively to protect our mental health. We need to respond positively to ensure that others adhere to the protocols. We need to respond positively to ensure that elderly are protected. We need to respond positively to ensure that the kids are protected because the kids are home, they're not at school. So the responsibility is ours.
Okay. Well, we also always ask our guests to send in the questions and comments live while we're on the show. We have this here from Michael Batiste on the chat. The government lack of coherent policy on COVID-19 is causing more transmission than the jab. Sending infected people back into the community to self-isolate is a dotish policy. Most households in Grenada is cramped. There must be makeshift hospitals to accommodate the infected. What do you say about a comment like that? What's your thoughts?
The comment is I disagree. I disagree with it. We have to be realistic in our approach to it, and to provide hospitals for the infected individuals would have required forward thinking, and so that should have happened before now. And so now it's almost impossible to have these set up. And so the best approach is what the government is doing to ensure that we pass on information. But the government is not enough because the government could only reach so much people. Only so much people would listen to the government for obvious reasons, for barriers, for dislikes, for political beliefs and etc. And so there are other leaders. There are the community leaders. There are the spiritual leaders. There are activists. There is the credit unions, the financial institutions, the businesses. All these the unions, who represent workers, and who are able to mobilize individuals and to get that message across. And that is where I would criticize the authorities. They did not take that holistic approach in including stakeholders from many different aspects or different backgrounds or from our context in Grenada. And now they're trying to do it by pulling in more individuals and engaging more individuals. I think it's good, but it's a bit late. So back to the suggestion by Mr. Batiste. Whilst it may be a good one, it sounds good on paper, it is not a practical one at this time, based on the limited resources that we have.
Okay. Another comment we have in here. Over the weekends, movement weekends, the Ministry of Health have been executing mass testing and vaccination pop-ups in different communities across Grenada. So Peter Cox is asking here, should there be a plan to have antibody testing to have more accurate count of how many people were infected? I think he's kind of asking about the rapid test versus the PCR and other different things.
There should have been is my response. And again, when you're strapped for resources, plus when you did not plan properly, that those things expose you. I don't believe that we understood that COVID-19 was going to get here sooner or later. Whether or not the government dropped the ball, whether or not there was other activities that were super spreader events, it was going to get here. And I don't believe that there was a contingency plan that included all those different facets that we could have used to collect accurate data, to be able to report data by different demographic characteristics that we could use to, to present to the world, to study, to understand better what happened here. There's going to be a second wave. and that data would have informed us on many things. And if we have not done that, then again, I believe that we would be a bit exposed for the second wave if we do not take certain lessons from the experience of the first wave. There's going to be a second wave. And so we have to be better prepared when it comes.
Okay, speaking of second wave, this takes us to another critical point and issue, vaccinations. Now, Grenada's vaccinations numbers are still relatively low to the rest of the population, even though in recent weeks we have seen a massive increase in terms of how many people get vaccinated per day. But the question is to you, are we at a stage where vaccinations will make a difference in fighting the pandemic, or are we at a stage where we just have to wait till the disease runs its course throughout our island?
Yes and no. We are at a stage where the vaccinations are going to make a difference among the vaccinated individuals. And they are, I think it's about 20-something thousand. So it's just over 25% of the population that has been vaccinated. I think it's 22,000 fully vaccinated. So yes, among these individuals, it's going to make a difference. The question is, what happens to the individuals who are not vaccinated? They are at risk for severe illness, especially the elderly and those with underlying medical conditions. And the truth is, Kitaka, as Grenadians, we need to understand that we have a lot of underlying conditions that greatly increases your risk of severe illness. Obesity, it continues to be on the rise. Pre-diabetic and diabetic conditions accounts for 33% of our population. That's 1 in every 3 individuals. We talk about stroke, cerebrovascular diseases, and those are very prevalent in Grenada. And so we have to understand the context of that. Now, the question you ask is, as I said, the vaccinated individuals, fine, it may make a difference among those individuals. But what about the other 80,000 individuals who have not been vaccinated? Do we have a plan for them? I mean, what are we, how do we, one, reduce their risk? And that could be in a number of, we could use a number of different strategies. So we may look to increase the vaccine uptake. So we decrease the hesitancy, but we know some individuals would not take the vaccine. I mean, we know that there is no population around the world that 100% of will take or accept the vaccine. So what do we do to reduce the risk of those individuals contracting, first of all, contracting COVID-19, and secondly, severe illness or death? And that's the sort of a thinking we should have. Whilst vaccinations have been proven to reduce severe illness and death, we must accept the fact that the 105,000 of citizens in Grenada would not accept or take the vaccine, and that's the reality. And so we must now think about alternative ways of getting those individuals to reduce the risk, so that we do not have a continued increase in the rates of infection and a continued increase in deaths. I mean, it's having a serious impact on Grenada. And so we must take a holistic approach. While the vaccine is proven to reduce risk, it has been proven globally, we must be accepting of the fact that everyone will not take it.
Okay, so based on that statement, will Grenada be able to reach WHO's recommended percentage of vaccination to secure herd immunity? And if so, what's your prediction in terms of timelines for something like that to happen?
I'm very careful to predict timelines, especially when it's dependent on individual behaviors and the removal of barriers so that we can have an increased uptake of the vaccines. And it is written, it has been documented that vaccine hesitancy is one of the top 10 challenges to public health globally, and WHO documented that in 2019. And if we research further, we would
Are you still there, guys? Well, I experienced extreme technical difficulty, like lightning struck, and like temporarily Wi-Fi went off and everything went off. I quickly went on to my data, so I'm back on right now. But I've lost Jared St. Clair and others who were tuned into the program. We're going to take a short break right now, and we will turn in a moment as we seek to rectify the technical difficulty. Thank you so much. Mr. Sinclair, I guess we both experienced the same situation at power outage. Are you without power right now?
I am without power, so I had to sign with my phone.
Yeah, well, I'm actually I'm working with data as well right now as well. And one of my guests as well just mentioned that no power as well. So I guess that's how it goes, a lot of rain, thunder, lightning going on. So
it's back now.
Yeah, but the last thing we were dealing with was the predictions in terms of timelines for herd immunity and thoughts around if Grenada will be able to reach that level of vaccination based on the reality on the ground right now.
Yes, and just let me, Kitaka, just let me explain something, clearly to the audience. The vaccines are unable to provide herd immunity, and I need to explain that, because herd immunity has to deal with the prevention of the spread, the actual spread of a disease, so that it gets to outbreak levels. What the vaccines does is that it really gives herd protection from severe illness and death, right? So the vaccines that we use, for example, mumps, measles, and rubella for kids, babies, MMR, they provide herd protection because they get full immunity. However, for these vaccines, for the this virus, initially we thought it was going to provide full protection, but we learned later that it wasn't the case once the Delta variant and the other variants started to present themselves. So it isn't really, we are not going to reach herd immunity, but we're going to get to a point where there is some form of protection at the population level, so we do not have the outbreaks that we are experiencing now in our first wave, because more individuals over time will develop certain levels of immunity, and it will make it a little bit more difficult for the virus to be transmitted from individual to individual if an individual gets infected. So the answer is no, we would not reach total herd immunity, but the protection would be close to that, in that we might see isolated pockets of outbreaks in the future, but not as bad as what you may experience in the first, second, or third wave. But that depends largely on the number of individuals within your population that would have been exposed to the vaccines, and to those who would have gotten infected. But we know that the protection doesn't last for a very long period. So there may be fluctuations, little isolated outbreaks occurring within the population from time to time. But that would be manageable. In terms of the reaching there and to that point where we get a large percentage of the population vaccinated, that would take, as I was talking, that would take a lot, and it would depend largely on the approach that we use. And I'm speaking about the authorities. And I did mention earlier on that a more inclusive approach of different stakeholders and individuals who can reach the communities, individuals who can reach those who are on the block, those individuals who have real concerns about the vaccine, those individuals who believe the vaccine is an experimental drug, those individuals who believe that the vaccines have some nanotechnology that is trying to insert DNA into our genes. So, there's a lot of misinformation out there that we need to deal with. There are a lot of barriers out there that we need to remove in order for the uptake of vaccine to increase. And that would take a scientific approach, because we need to find out what are the barriers first before we try to remove them. Once we find out what the barriers are, then we can tailor our messages, we can tailor our programs, we can tailor our interventions to remove them. But if we continue to shoot at a moving target, and the target is moving faster than we are able to follow it, then we may be missing it for a long period. So my take is that I cannot predict. It is largely dependent on the approach that the authorities take, a more holistic one. First of all, to provide some form of education to the individuals who are hesitant and who would not take the vaccine in the interim. At the same time, find out what the barriers are to the vaccine uptake or acceptance, and work on intervention messages and activities through outreach to the communities to increase your uptake in the meantime. So in that way, I believe we'll be covering all ends, because it has been proven that individuals who are hesitant to take the vaccines are not anti-vaxxers. They're just hesitant. So some of them would go on to take it. Some of them may refrain, but we can still get some of that cohort of individuals to accept the vaccine.
Okay. Well, as a wrap up now, final question to you. Recently, Gaston Brown, Prime Minister of Antigua, has been heavy in the news, after, his government took the decision to mandate vaccines for certain public officers and so on within their society. I also went in and listened to his parliamentary expressions last week, and he made a point that persuasion and public education programs are stimulus for is a particular stimuli for a certain demographic of people. And he's seen that a large demographic of people do not respond well to that. And hence, he was using that as his argument to say that to really get over this crisis and to really move forward, mandating vaccinations would be a very critical step. So I wanted to get your stance in terms of where do you stand in terms of that approach? Like, do you see that as something that soon Grenada may have to look at? Is there any other alternatives?
I am
And do you think that would help to finally like get us back in terms of economical activity and so on?
I am critical. I am critical to Gaston Brown's approach and how he used it. While I understand the reasons why, I believe it was not done in the right way, because one, it painted Grenada as a country that were experiencing COVID-19 infections very different when we have a first wave of infections, we expect to see a spike in cases and deaths over a short period of time. And again, that can be related to how prepared we were, how sensitized we were, how well adjusted we were to the protocols, etc. In terms of mandatory vaccinations, I don't totally subscribe to it. In some situations, based on businesses and based on the products that you may sell and your interactions with individuals, that would affect your business and it would have a direct impact on employment, etc. So whilst I see the need, so for example, the universities, I work at St. George's University, they made vaccinations mandatory for students, employees, right, staff, whatever, faculty, right? So whilst I may have my reservations about it, I understood why they were doing it. You understand what I'm saying? So, and that is so we have to be very careful, those in authority, in how we portray that message to the population, because it's going to take a while before this vaccines get accepted. Remember, this generation, this is the first time we've experienced in a pandemic. So there would be many different responses, whether it's verbally, psychologically, spiritually, your beliefs on the reasons why. There are many things that are going to happen because it's an unsettling time. This is the first time we are experiencing a pandemic of this nature, and where we have millions of individuals who have been infected and who have died. And it has happened globally. So the authorities need to be very careful in the approach that is used because it may be more harmful than a productive one. And so, the individuals must be informed of the science. We cannot just speak because we're an authority and say, well, this is what we're going to do and this is what we want to do without considering the individuals. Remember, if we want an individual to comply with what we believe is going to be helpful, we must understand the individual's position. We must respect their beliefs. We must respect their difference of opinions. We must respect their practices. We must respect that. We must find a common ground. And so moving forward, I would hope that authorities consider, first of all, because when you consider individuals, Kitaka, people trust you. And when people trust you, you're able to sell your service or your whatever you want to provide to the individuals. If there is a lack of trust, individuals would not adhere to it. Individuals would find all reasons to beat the system, all different ways to beat the system. And so we have to be mindful of that. That trust is a major issue with accepting a vaccine like this, that one, initially was thought to provide full coverage. Two, was rolled out in a very short space of time compared to other vaccines, right? And three, uses a new technology. So you understand just off the bat, if you do not understand behind the scenes reasons why the three things I've listed were allowed or were possible, then you as an individual would not accept the vaccine. And I'm a student of science. I went to research. I knew about the mRNA technologies. I knew it was under development. I mean, I understand the whole objective when you have vaccine programs and vaccine rollouts, especially in a pandemic, but not everyone knows that. And so if you are gonna try to have individuals accept it, and you recognize that they are hesitant, that means that there are barriers. And if there are barriers, they must be removed. And if we remove them, then the individuals would change their minds, some of them, and that would increase the uptake. So I would not be able to predict, but we would get to that point eventually. I don't know when. COVID-19 would eventually become one of the diseases that we experience annually in smaller numbers, just like in Grenada. We experience dengue annually in certain times of the year. COVID-19 will become an endemic disease in globally. So in the context of that, we have to think about how can we lower our risk and protect ourselves as much as possible as citizens. And we need to sell that bigger picture to other individuals. With time, people may accept it. With time, people would become less stressed over the differences, the whole issue of not trusting the vaccines. Over time, it's going to happen, and we are the ones that should be the agents of that change. We are the ones that should be pushing that information in a way that it will be more accepting, because COVID-19 is not going to go. It's going to be here forever. We are not going to go back to a normal state of functioning pre-COVID. This how we function now. If we will continue to function like that with changes over time, but we would not return to pre-COVID conditions. And that's a fact. This is here to stay.
Okay. And on that note, Sinclair, I would like to say thank you for joining us on the program, and wish you the best for the rest of the weekend and the upcoming week. And thank you for always being ready and available to share in your area of expertise. Thank you so much, my brother.
All right. Thank you, Kitako, for having me, and do enjoy the rest of the day and the weekend as well.
Okay. Thank you.
All right, bye-bye.
So, folks, we'll take a short break right now, and we'll return for segment 2, where we dive in with COVID survivors and individuals who have, had COVID-19 within their family, and how they have navigated the whole COVID-19 infection and that entire process. So stick with us here on the Bubb Report, and we'll be back in a moment.
I'm Emmanuel. Yeah. So not my mother will take care of me. She died in childbirth. My father said he was too white you would keep them with him.
Yeah.
But if it's the girl, leaving a girl in Grenada. So it's set now for Jericho. You understand? I like Jericho. I belong to Mount Pleasant. I belong to Belmont. His children are made in Leicester. I come and I live in Leicester. So people don't look for me. You like it? Yes, to me, and them. Well, when you they make one party, they give you to eat. And when you go to school, when you come, they give you food and clothes.
Since losing that seat, what have you been up to? Now, Mr. Attorney General, this particular provision sounds unconstitutional. But why were there not consultations before moving forward with the proposals? Did they say what will happen when you guys get to St. Vincent? Because there are pressing social economic issues that I would want to address with you. In the hyper-information age of social media, the Bubb Report knows there is more to the story. We have questions and demand answers. We strive to hold the powerful accountable and tell an unbiased, contextual story. You know what happened. We let you know why it happened. There is always more to the story. The Bubb Report, streaming every Sunday at 11 a.m. on Facebook and YouTube.
Okay, welcome back to everyone. Bubb Report. As I said before the break, we dive in with our panelists of, COVID survivors and people who have dealt with COVID-19 in some way, shape, or form. Brenda, if you're there with us, I know Grenadians have faced a mini power outage, so you're here with us now. But yeah, the idea came about to check in with people who have made the journey, because COVID-19 is hot on the lips of everyone, and people who have made the journey in some particular way. And maybe this might help to give individuals now some insight or some hope into how they can navigate and because I think you guys look very strong and healthy to me right now, and I'm happy that you guys were able to make it through and you were not casualties to the COVID-19 situation. I also welcome all of you to be here because I know it may be a challenge sometimes to open up and share stories like that, so we really appreciate you taking time out to do so. Now, first off, I will start with you, Jennifer, sustainability advisor, Grenadian at heart, currently in Canada. Talk to us about your experience and fight with COVID-19. How did it happen, and how were you able to manage the illness and overcome?
Thank you, Kateka. Yes, I am still a Grenadian at heart, and I'm still a citizen. I was one of the first people infected. So I got the virus at the very, very beginning of the pandemic. I was renting an apartment in a house that had a lot of shared airspace in the vents between myself and another occupant that lived upstairs. And the occupant that lived upstairs was a taxi driver, and they had likely driven a COVID positive patient contracted it themselves. The entire family got sick upstairs, and then we got sick downstairs after that. And it was a really frightening experience because there wasn't a lot known about the disease at the time. So I didn't know what to expect. There wasn't any public health guidance available at the time. And I had to soldier through on my own using whatever information I could find wherever I could find it. And in the first week, it was actually kind of like a 3 out of 10 in terms of severity. It wasn't so bad. But it was an atypical experience. So normally when you get a cold, you get a sore throat or you get a runny nose, and things progress from one stage to the other. But in my experience with COVID, it wasn't like that. You'd get bursts of time where a couple of hours I'd have a sore throat, then a couple of hours I had a headache, and then for a couple of hours I'd have like rigors. I'd be under the covers in the bed, with 3 or 4 blankets on and a sweater, just shivering, frozen. And I didn't have a fever. My temperature went very, very, very low. And I had a low temperature for the entire duration of the virus. And then I thought that I was winning it. I was drinking my lemon water and taking, healthy foods in, and I thought everything was fine. And then I had 2 days where I thought I was better until it was a Friday morning. I woke up, started working at my computer at around 7 a.m. And by 9 o'clock in the morning, I felt quite sick. And hour by hour, my circumstance changed. I just got worse and worse and worse and worse so quickly. And when I think back to that day, how it had started out normal, but by the evening time, by bedtime, I was quite convinced that I wasn't going to make it through the night. It was terrifying. And we were not allowed you weren't allowed to drive to the hospital. You had to phone a hotline and get kind of permission to go to the hospital and alert them so that they could, gear up and be ready for patients. And it was a really difficult decision to make because the telehealth people were telling me that I needed to go to emergency because I was going critical pretty quickly, but I was a single parent and I couldn't leave my child unattended. And, public health was saying to me, well, couldn't you just hand your child over to someone? And who am I going to hand my child over to? So for me, it was kind of a dual crisis because I was fighting to survive the virus, but also fighting to maintain my responsibility as a parent and being really, really afraid that if I passed away, my daughter was going to have to deal with the aftermath of that, and that would change her life forever. I'm lucky that I did survive the critical period. It lasted about 4 days for me. And in those 4 days, I do not have much recollection of anything really. It's a big blur. I was, very low on oxygen and struggling. But I did survive and I did make it. And it took about a month and a half to get back to a level of activity that was maybe 50% or 70% of the level that I used to have before COVID. And then several months after I had been infected, a Facebook group developed what we called COVID long haulers. And when I first joined, there were only about 15 people in it. And now there's thousands and thousands of people because some of us who have survived the disease have ended up with what's called like a long COVID syndrome. And the COVID continues to cause problems over time with various different things. So I have chronic difficulty breathing. I use an inhaler on a regular basis, which I never used to do. I have medication to support my heart because I have heart tremors that I never used to have. And I have cognitive issues. Sometimes I'll say the same word twice, or I'll go to recall something and I can't pull it up. I could look at your face or someone else's face, someone that I know, and I can't remember their name. And that sudden change, it's like a brain fog or COVID brain referred to. And it's very frustrating and kind of scary because these things impact your ability to earn a living. And we have not got far enough down the road to even consider how we're going to tackle the longer term and more chronic impacts that the disease may have.
Okay. And hearing those stories, I empathize with your situation, and I pray that in some way, shape, or form that you're able to to reach to a point where it improves over time. And I hope that, of course, Brenda, can you unmute your mic for me before we jump in with you?
Yes, I do.
Well, Brenda, I mean, you have coming in from a different situation. I don't think you have had COVID specifically, but you have, been navigating, taking care of within your own capacity, within your own home, like COVID-19 patients. So I'm eager to understand, like, what has that process been like for you? Having to like live amongst COVID and provide support to individuals who are infected within your space.
Well, Kitaka, as a parent, I'm living at home here, and I had one daughter here living with me, and she's 17. She came home and told me that she was exposed to somebody who was exposed to another person, as you know, most people would have gotten it. And immediately I said, okay, well, in that case, you are going to be stuck in your room, and whatever it is you need, I'm going to be the one out here trying to navigate what it is you know, to help you out. So we established some ground rules. She's enclosed in a room. I take from water, tissue, food, drink, everything. And the only thing though, the ministry had advised that, you do not use shared bathroom space. But, in Grenada here, most families would only have one bathroom in the house. So naturally, we had to set up some rules. And because we were isolated together, because once she has it, then I have to be isolated as well, because I did not know if I had it at the time. I went to get tested and they refused to test me. But I just said, okay, because she's home for the 14 days, then I am here because I am the only caregiver here for at the moment. So whenever she comes out and she has to use the bathroom, then, obviously I become a cleaner and a nurse. I have to go and sanitize and, wipe down everything and make sure everything is cleaned and ready for anybody else to use. So it has been challenging, sometimes more mentally, because we had a conversation afterwards, when she was declared that she was safe to be out here after 14 days. And she was like, Mommy, Afeni was conning me. And I had to explain certain things to her and let her know it's not a matter of conning you, but as a parent, I had to protect myself from getting it and also ensure that, she doesn't keep on going around with the germs and the infection around. So mentally, I think it can really take a toll on you, especially, when you see people doing certain things, you think that they're scanning you or but we made it through.
What do you think was helpful or beneficial in the whole process of recovery and overcoming the illness?
The fact that, I read up stuff a lot. I had a lot of people, well, I could say I had a good support system in terms of family and friends reaching out to, give me advice, give me information. And yes, information can be very tactical out there when you're hearing it from all different sides, because, I would be hearing the ones that might not be as good to listen to during this COVID time, because when you have that particular thing dealing with, you do not want to hear too much of negative stuff, and you do not want to hear things that is like doom and gloom. So but I had a good support system, and they were encouraging me. I used a lot of local stuff because of course they did not give her any medications or anything like that. They told her to go home and to isolate, drink plenty fluids. So I had to improvise and think, okay, well, drink a lot of water, yes, give her the vitamin C. And then some people recommended that we introduce the vitamin D and the vitamin zinc. Actually, I don't think we actually got it, but I use local stuff like the ginger and other things that would contain zinc in it. So I would give her different teas, infused with local herbs and things like the ginger and so. And over time, ensure that she gets all her meals, gets it on time, ensure that she gets rest. So for quite a long period of time, she was not even on any social media or any computer or phone, laptop, anything like that. She was just allowed to just stay in her room, sleep, rest, eat, and that's it. She would come out after that to get like about 20 minutes, 30 minutes sunshine, just sit down in the sun and just relax a bit. But basically, that's how we sort of manage it.
Okay. I Joe. Thanks again for joining us. I'll bring
Yes,
you
sir.
in. I know you have not been infected by the virus per se, but I mean, you are from the parish of St. John, a community that has been, ravaged by the virus in terms of infections and so on. So we want to get an idea as to how has the COVID-19 pandemic affected your community as well as Grenadian diaspora community in New York, which was hit hard by the pandemic last year, and how were you able to ride out that crisis period and stay unscathed by the COVID?
Well, thank you very much for having me here on this program. And well, my community of St. John's has been hit very hard, and you know, it hurts a lot because it's a lot of people that I know, people who mean a whole lot to me. I do not want to get into any names or anything like that, but it has been a really rough month so far for us, the people of St. John, because we have seen a lot of people that we grew up with, a lot of people who mean a lot to us, like our church members, pastors, and so forth, succumb to the dreadful coronavirus. Well, my experience here in the diaspora, I live in New York City. And as we could all remember, at one point, New York City was the epicenter of the pandemic, in the early days of the pandemic, as I would say. And it was really scary. Nobody knew what to do, how to handle this. And um, I think it's the grace and the mercy of God I was able to escape this, because I still had to go out to work and to do what I had to do on a daily basis. And what I can tell you from what I witnessed here in New York City, um, I used to pass by the Brookdale Hospital almost every day, and I would see ambulances lining up for blocks, waiting on their turn to get into the emergency room. And that gave a sense of how serious the matter is. Every minute of the day, you would see ambulances shooting down the street, pulling up in your neighborhood. Like in my neighborhood, we don't really see much activities in terms of emergencies, but there were multiple emergency situations every night, my neighbors and so forth. And with that being said, you know, I always thought about Grenada, because at that time, we were enjoying not having a lot of cases because the country was locked down and so forth. But my fear is that people were going to become complacent when the country opened back up, and we would have what we have now. So what I did, I tried warning everybody based on what I saw here in New York City, because at one point, people who had other ailments like asthma and heart problems and so forth, they were saying, don't come to the hospital. They're not going to send all the emergency people to get them. They may have to just die. And that was a grim situation. I've had friends who passed away. I had family members or friends of mine who passed away. So I just saw the horror. And I really did not want that for Grenada. So, I got on my social media all the time telling people, hey, y'all don't get complacent. Prepare yourselves, because this thing is real. And around that time, a lot of people had a lot of conspiracy theories going around that it's 5G, it's a made up something. And that really concerned me, because I'm seeing the effects. I'm seeing what it's doing to family members and friends of mine. I have friends who are doctors and friends who are nurses, and they would come back with the reports of what they're seeing in the hospitals. And I just felt that I wish that people had looked elsewhere in the world and see what was going on and become better prepared. I know I went along the grain, because a lot of other people in the religious community, they don't believe in probably the vaccine and all of these things. But it's very difficult for me to stay on that side when I've seen what I've seen. I've traveled extensively between New York, New Jersey, Pennsylvania, Connecticut, and sometimes I see those freezer trucks parked outside the hospitals and everything. And I'm asking myself, why are people not taking this very seriously? So, as an evangelist, as a gospel singer, as somebody with a platform, I took it upon myself, in spite of the ridicule, in spite of people saying I'm spreading doom and gloom, to sound the alarm and tell people, hey, this thing is real. Prepare yourselves because it's going to be bad. I did that for a couple of months. A lot of people weren't taking me seriously. And lo and behold, it happened, and it's just really devastating right now. But I believe as a people, we are strong. We are strong Grenadian people. We are very resilient. We've been through a lot. Hurricane Ivan, Emily, a lot of things in our past, and I do believe that we can get through this together.
Yeah. Thank you, Aichel. Well, Jennifer, I'll bring you back in as well as you, Brenda. I think you'll unmute your mic for me, Jen. I mean, in mention of vaccinations. I mean, you caught the virus before vaccinations, but currently you are fully vaccinated.
And vaccine injured too.
Say that again?
I'm vaccine injured as well. So I kind of run through it all. I did. I'm and I work in an educational setting, so a vaccination is a requirement for employment, and I agree with that. Given that I'm particularly dealing with elementary school children who are not vaccinated and vulnerable. But when I took the second vaccine, I think because I had already been infected, my body went into overdrive with an immune response, and my lymph nodes grew like lemons. My armpit swelled up to my collarbone, and it's quite painful. And I went to the emergency room, and they ran some tests and so on. And what they found mimics breast cancer, actually. But what it turns out to be is just the vaccine is telling the body to be manufacturing antibodies, and my body went nuts in doing that, and the lymph nodes expanded in the process. So they've gone down. It took about a month and a half for the swelling to go down, and the pain that's associated with the swelling, obviously. And on the upside, I did get my antibodies checked, and my antibody for the spike protein is over 2,500, which is great. And so like a typical double vax person, I think, would have a much lower rate in the hundreds. So I don't think that the medical community is ready to declare that an absolute immunity, but it certainly gives me a considerable peace of mind that it's worked. I'm not sure that I'd want to take a third shot, though. So I guess we'll see some lessons learned.
Okay. But what has that experience? What does that experience like showed you? I mean, and what's your? Would you, if you had more information, would you not taking the vaccine?
I'm disappointed that there wasn't more information available about this particular side effect, because it does impact, I think, somewhere near 10% of the people who receive the vaccines, particularly those who've already had the virus. On the other hand, the impact so far has been relatively benign. In fact, what it showed in tests, follow-up tests, is that my body's immunity has done a really good job. But the honest to God truth is, in the early days when I didn't quite know what was going on, and it was a little scary, I still feel that when you're dealing with such a large scale crisis like this, and you have to, as a people, as humans, as a species, we have to make decisions in the common good. Making decisions for the common good sometimes means that there will be people who are innocent who will have to make sacrifices in order for that greater good. And I genuinely believe that had I been a more serious casualty of a vaccine injury, I would be prepared to accept that as my civic responsibility, because my sacrifice might be saving millions of other people's lives. So I feel it's a little egocentric to feel that all of the solutions need to cater to everybody's individual needs. We have to make timely decisions. We have to make cost-effective decisions, and we have to make decisions that are going to get our communities and our societies back on track with minimal loss. So I would do it again, despite the complications.
Oh, Brenda, sorry, my mic was muted.
Your mic, yeah.
in terms of your experience, in terms of vaccinations and so on, and like what's your thoughts on the whole process and where we are currently within our country?
Um, when it comes to vaccination, I think people have to make a decision based on their health, first of all. I think you should consult a doctor, especially if you have underlying problems or other symptoms that you're not sure of how that vaccine would affect you. I'm not an anti-vax person. However, I have been one that have been very hesitant based on underlying, conditions that I needed to be clear, and I needed to know what would be the impact of taking a vaccine when you have certain conditions. So it all boils down to individual responsibility, and the process of educating, though I think that though the information is out there, I think we need to do a much better job in terms of getting that rightful information out there. Because up until I believe I looked at this very program with Dr. Sincere, I did not know certain, types of information that was kind of bugging me for a while. So, and he was able to clear up a lot of them. So I think we need a lot more public relation information going out there to inform people and to educate people, because you have to make an informed choice. Yes, you can do, take the vaccine, and you can do something for the greater good, but you also have to consider the impact on yourself as well, because you're not just going to go and take a vaccine and go in blinded. So that's just my take in terms of how it is being done. I think when the vaccine was just introduced, it wasn't being done in a very good way, because they had centers, yes, but the centers to me was encouraging persons to go out there and more or less line up in a long lines, and you're waiting for hours before you can actually get vaccinated. To me, if you not tested and you just decide to go and get a vaccine, and you're in those lines, you are more susceptible to actually catching the virus. However, I have since, I've had conversations with a lot of people, and I've since seen that the ministry took a different approach by going into the villages and, getting the access out there to the people who need it. So you kind of lessen on the gathering and the mass, coming together of people that would actually facilitate spread, even though they're going there to do the vaccination. Because sometimes I think we're still not getting that picture of the mindfulness, the sense of responsibility that we need to have. I've seen persons in line, and people, they stand up and they're over one another's shoulders. Now, I would feel very uncomfortable, because if I'm going there, whether it means I'm going in the supermarket, I'm going at the health clinic, wherever it is, I do not want anybody standing that close to me. And I think most persons, people out there, have not been doing that. They stand in line, and they figure, oh, it's a line, so we need to stand close. I'm here, and you're just not even like 2 feet away behind my back. So they're not cognizant of the protocols that they should be adhering to. And I think we really need to crack down on that, because that is one of the reasons that we have so much spread going around.
Okay. Joe.
Yes, sir.
I mean, you mentioned you're an evangelist, gospel singer, What advice do you have for people in Grenada right now who are experiencing that certain level of uncertainty, mental static, and anxiety during this time? Because, I mean, in many different ways, a lot of people in Grenada are going through it in different
Yes,
circumstances. What advice would you give to them?
yes. Well, first of all, I would say I believe the ultimate solution to every problem, every situation is that relationship with God. And I'm a firm believer in the Bible and its words. And as the Bible says, God would never leave us; He would never forsake us. And this is a time when we need to beef up our faith and trust our Creator a whole lot more. Prayer, pray to Him. He said He would give us protection, and even against the virus. Also, I want to encourage our people, the people of the Christian faith in particular, because Grenada is largely a Christian country, if I should put it like that. And as an evangelist, I would tell people right now, do your reading, do your research, make common sense decisions. Don't just go by what people are telling you. Don't just take information that you pick up on the internet. You now have to make a decision for the welfare and the safety of your family, and do everything that you're supposed to do to make sure that your life is preserved. I want to let people know that there is hope, that we can make it through this by the help of God. And as tough as it's going to get, and it might get even tougher, we may have a second wave, but we got to trust and believe that we can make it through this together.
Are you with us there, Ijel? I just seem to have having some technical difficulties. I'll pull you in, Jennifer. I mean, you're someone who has worked in various capacities as well in terms of managing, crisis and risk and sustainability advising and so on. Apart from the COVID-19 public health situation, like in your observations of Grenada, what are some other things you're seeing that we need to pay close attention to and to address, and to not make the crisis get worse and spill off into other sectors of our society?
Yes, I think Grenada is at great risk of a pandemic within a pandemic developing, that is brought on by hunger, and a lack of financial resources and isolation. I'm starting to see people that I know. I'm in North America, well, in Canada right now, but I'm seeing my friends and my family talking about being confused about what day of the week it is, and those kinds of phenomena that people in North America, particularly in Canada, where we did a lot of locking down, have experienced in the past, and that has a mental toll, and it has it exposes people who live in abusive situations to even more vulnerability because they are isolated. And when the country itself is grappling with staying ahead of the COVID pandemic, other resources get tapped to the max. And so not only are people who might be subjected to domestic violence isolated and at higher risk, potential solutions are out for them in terms of the social safety nets that would otherwise be available are more difficult to access. That becomes a major problem. Food security is a major problem for, I think, a lot of households. I've had people contacting me, knowing that I'm in Canada, and I guess imagining that I can do something to help, and I've done everything I can, but there are families that have asked me for help where one member of the family has tested positive, or maybe two, and the family is not able to go out, and they've been using their food. This was actually a family in St. John had contacted me, and they had COVID. They had been feeding themselves and their neighbor with the food that they had. Their neighbor has COVID as well. And because the COVID was cycling through the family, the period of isolation was long and they were running out of food. So they contacted me, and I managed to reach out to someone in Grenada, and we were able to get some food up to that particular family. Since then, myself and a pretty large group of volunteers in the diaspora community, as well as within Grenada, are doing everything we can to design a food security program, or a food program, where we can provide pre-made meals to people. One of the things I found in my COVID experience was I was so sick, there was no hope that I could cook a meal. And if we start delivering rice and peas and sweet milk to people, they're not going to be able to cook it if they're sick. So, and I think our hospital workers and our frontline workers are working double shifts and triple shifts, really, really long hours, 7 days a week, and everybody's stretched to the max. And I think our frontline workers need support with pre-made meals as well, to provide them with some relief and some compassion and some appreciation. So I think that becomes an additional priority. In addition to that, we are finding here in Canada, in the province of Alberta, the country opened up and took COVID is going to be an endemic situation. We have a very high vaccination rate. So in Alberta, the vaccination rate for fully vaccinated individuals is 73.4%. It's very high. The remaining population that's not vaccinated is now ending up in the hospital. We're having another wave. And the system is so overrun. The healthcare workers unions are calling on the province to call in the army for support in a developed country with, a really good medical health infrastructure. And this is with 20,000 active cases. This is so, if it can overwhelm a rich country's infrastructure to the point where they feel they need to call, there's calls for the army, and there are some hospital facilities that are saying there's a do not resuscitate for anybody that goes like into an arrest or is in a life and death situation. So a universal DNR for patients is a pretty critical situation, and I think that's one of the reasons why the government in Grenada has been looking at establishing an ethics committee, because if the numbers continue to climb, eventually the medical teams are going to have to make those horrible decisions. And it is morally incomprehensible to imagine working an individual day after day after day in long hours, emotional conditions, in a crisis, and then ask them to choose who they are going to who decide who lives and dies without the criteria there, and some support from an ethics committee that can guide those decisions for them, because those are things that are going to weigh on them in the future. And I think we owe some respect to the people who are working on those front lines and having to face it.
Yeah. And Brenda, your experience in caring for a COVID-19 patient and so on, and navigating that landscape, what other critical things that you learned, lessons, insights into the whole COVID-19 situation in Grenada?
Well, first of all, like Jennifer was speaking about food security. Now, I come from an agriculture background, so what I would like to encourage persons to do is to, establish a backyard garden, plant whatever bit of food that you can have in whatever space that you have around. And even if you don't have much space, you can always plant in containers and trays and other things like that. The Ministry of Agriculture is always there. You can reach out to, the ministry, to the officers, in the different districts, and you can get assistance. Because one of the things that I realized, that once they send us into isolation, then, we had to look around and look into the cupboards and the fridge and realize, hey, we need food. So how are we going to get food from the outside? And then I had to contact friends and family. And there was a group of people who actually, I had sent a message on Facebook one day because I needed to get some supplies. And I was referred to that group of people. And they came and they drop off, a hamper for myself and my other two daughters, because that's the next thing. Even though I had one here, all of my daughters ended up being COVID-19 positive. I have three daughters. I'm not even sure if my granddaughter had gotten it, because she had a lot of symptoms. She was not tested, but she went through the whole phase. And we were really, really frightened, because seeing how she was holding up at one point in time. She lost a lot of weight. She was eating high fever and things like that. So it is important to have a support system, just like you do for maybe hurricane season. Try and always have some type of foodstuff that you can rely on the inside. And because when you go and get tested and you don't know your status, it's difficult to kind of plan ahead. When you do know it, they tell you to go straight home and be isolated. Now, if you are being responsible, you will do just that. If you are not, then obviously some people would still go into the supermarkets. They will still go to the ATM. They will still go to all the different places that they think that they would need to basically cover themselves while they are inside. So that in itself, I have said to people before that we do need some kind of social grouping, or the groups that are existing in communities. They should start, coming up with a plan to assist families and, assist the community members in trying to navigate through that period of time. So I don't know if that has really cleared up what you were asking.
Yeah, thank you. Joe, bringing you back
Yeah,
in here.
yeah.
I mean, as an evangelist, we had a little technical difficulty with you there, but great to have you back. As an evangelist and a man of the cloth, what role do you see the church and the Christian faith playing in terms of being there for the people who are facing so much challenges and suffering a lot under the whole COVID-19 situation?
Yes. So I think this is the perfect opportunity for the church, for the Christian religion, if you want to put it like that, to demonstrate Christ, to demonstrate love and compassion and just sympathy and empathy. Because I think now more than ever, Grenada needs the church. Grenada needs the church united, and we're called to be servants. And even Jesus Christ, while he was crucified and he's dying on the cross, he took time out from dying, from sacrificing his life to save one more person. And that story remains in my mind, a thief, that Christ would postpone his purpose and postpone dying just to save one more person. And I believe that in the midst of this global pandemic, in the midst of this pandemic, this is the time when the church should go and serve the community, especially the communities where the church is located. Its immediate vicinity should reach out to the families. I know a lot of churches are doing that right now. There's a lot of ministries who are really bringing food hampers to people. So it's a call for service, and it's a call to demonstrate Christ. And I would even advise, like, some of the other people who might be putting some information out there that may not be helping the situation right now. Let's make this about the recovery. Let's make this about helping people to get better, because if the church could, get medical supplies with its connections, because, the church is connected, and, with the international community, like, for example, the Seventh-day Adventist Church has a very wide network around the world, the Roman Catholic churches. So if we can pull all of these resources together and send it to Grenada, we'll be able to stamp out COVID-19 and to help people to survive. What I can say is that here in the diaspora, a lot of groups from Grenada have been, doing supplies drives and so forth, and shipping supplies to Grenada. Even my ministry, we're getting like masks and stuff to get ready to send to Grenada. I already spoke to some individuals who have given me the assurance that they're going to be donating some supplies, because they're all very concerned about what is going on in our beautiful island. And I believe this is the time where faith plays a major role, because of the mental impact that COVID-19 would have on the people. There needs to be an outlet. There needs to be an avenue through which people can express themselves. So this is the time when the pastors and the leaders and the priests and so forth, and not just in the Christian community, but in every religious community. I'm calling on all religious leaders, everyone who's capable of providing some form of mental support, our counselors and our therapists and so forth, that can provide just a cushion, maybe a hug, maybe just not a hug, but you know what I'm saying, but a phone call to somebody to see how they're doing, because people might be in isolation right now. Let's make it our duty to pick up the phone and call somebody to see how they're doing, or send them a message on social media just to check in on our neighbors, check in on somebody, because that would go a very, very long way. And I'll continue putting my music out there so people can listen to the songs, and hopefully that can provide some form of encouragement for folks out there as well. We got a lot of work to do, and I believe that those of us who are capable, those of us who are well right now, let us use that energy to encourage people, to give people a little push and say, hey, you can make it, we can do this, and we can get out on the other side together. So it's my hope that, supporting each other mentally would be on the forefront of all the information that we put out there. Let's put posts on social media that's going to, encourage and uplift our spirits. I believe we've been through different stages of grief so far, and I think now is the time where we finally need to accept that this is the reality, and let's do all that we can to help people out of this situation.
Okay, Jennifer, Brenda, or Jennifer, you first. Well, guys, it's at 12:40 now, so we're arriving at the position where we have to, wrap up and have final thoughts as we end the program today. So everyone would have an opportunity to share their final thoughts and the final message or whatever you'd like to share to all the viewers listening in on the program right now. We'll start with you, Jennifer, move to Brenda, and then we'll round up with you, Igel.
Sorry, not unmuting.
Yeah.
There. Oh,
yeah,
there we go. Well, I don't think anything I could say, I could compete with the motivational capacity that Mr. Joseph has. He's quite a passionate speaker. I think that we will persevere. And one of the things that I've found in life, I've met many, many challenges, and there can be no change without friction. And this is a lot of friction, and friction creates movement. And there's a lot of things in Grenada that need to shift. And this kind of pressure is the kind of thing that can bring our communities together. It can encourage us to take a harder look at some of the things that we need to change. There was some mention by the epidemiologist who was speaking earlier about planning and preparing. And I think we have a changed world coming. And we can start to plan and prepare for that. And Grenada is a very resilient country. Despite the hardships that Grenada is facing, it will bounce back. The economy and people's ability to support themselves and their families will return, and we can make a brighter and better future together if we are able to take the lessons learned from this crisis and work together and deal with the foundation issues that have created the crisis that we're in, such as public trust. And if public trust has been undermined, then we should fix it and do a better job working together and help.
Okay, thank you, Jennifer. Brenda, final thoughts.
My final thoughts would be, being well and thinking about your health. This is a holistic thing. So not just only because of COVID, but I would like to encourage people to think about, what you eat, get enough sleep, just do everything that can boost your health and boost your immune systems, because eating local, eating healthy foods, incorporate all the colors in your diet, and make sure that you're doing the things that you can make your body healthy, because your body would need to withstand it once you get it. If you do not get it, you will still need to have a healthy immune system to support those around you. And as far as the community is concerned, I would join in the others to say, please, let's bind together and let us do what we can to support our neighbors and the members of our communities, because we do need each other in a time like that. I know I am being part of a group right now who are, we liaison with the diaspora, some of the diaspora members in Canada and other areas. I'll be out of isolation soon, but as soon as I get out, we would be distributing some of the sanitation items and masks and other things to members of the community. So I really urge you all out there to be mindful and to take personal responsibility and, keep your family safe and keep yourself safe as well.
Yeah, Igel, the ball is in your court for the final play. I think you have to unmute your mic for me.
Right. So I just want to use those final words to offer my support, my appreciation for all of the hard-working healthcare professionals in Grenada, for the doctors and the nurses they've got families themselves, but they expose themselves to a deadly virus so that other people can be well, other people's lives can be saved. Guys, we are proud of you. We thank God for you. We love you. I hope that you'll be able to get a huge raise in salary someday, just to as a form of our appreciation for the hard work that you are doing, even to the religious leaders who have been there encouraging and providing that support. All of the people, everyone involved in making this situation easier, a easier burden to bear. And I want to encourage everybody to stay positive, to remember that we are Grenadians at heart, because there is something that we say, I think it's written somewhere, that says, brighter out of darkness. And may we emerge brighter out of darkness. And with God by our side, we can do all things through Him who strengthens us. And hold on to your faith, hold on to the scriptures, hold on to Jesus Christ, hold on to the Lord, and we can make it out of this together. And again, we can do this. We can do this. We can do this. And also to the authorities, to our leaders, the government, the prime minister, and all of these people. I do not want to be in your shoes right now. I believe that God had set you guys up for such a time like this, because this is so difficult. But in the midst of this storm, in the midst of the trials, in the midst of the tribulations, I want us to be comforted by the loving arms of God. And to all of the people who have already lost loved ones, to all of the people who are taking care of loved ones, and it's so hard and it's so difficult, I want to let you know that you are in our thoughts and in our prayers. And I pray, God, for your strength. And I pray, God, that depression would not set in. I pray, God, that there would not be any suicides. I pray, God, that there would not be any crimes committed as a result of the hardship. I want to encourage all of the Grenadian people to be disciplined, to be patient, because we're going to need a lot of patience to make it through this dark hour. But I just want to quote again, we're going to emerge brighter out of darkness. God is on our side. God bless you, everyone, as we continue to fight this deadly enemy together.
Thank you so much, Igel, and thank you, Jennifer and Brenda and Mr. Sinclair, and for all the hopeful messages and all the energy that you guys have shared, and the information and the stories that you've shared on today's program. I see hope as a very powerful force. Maybe there is no magic in it, but when you know what you hope for most and hold on to it, it's like light within you. You can make things happen almost like magic when you have that hope. And I think, sometimes when we turn around, it seems very dark and gloomy and uncertain. And I think we have a responsibility to keep hope alive and to be there for each other in this time. And my money and my bet is on Grenada and our collective spirit to rise and overcome. So I thank everyone who took time out today to join the show, listening, all our guests, and everyone who made it possible. My name is Kitaka Maoto, filling in temporarily for Dr. Bob today. It's his birthday, so everyone, you can go over to his personal page, wish him happy birthday. He'll be back with you guys next week. Everyone of us at the production team here at Bubb Report, wishes him a happy birthday. And all the panelists, thank you guys so much. Have a fantastic week, and stay safe.
You too. Thank you.
All right. Have a